Hi, it's Melissa here from Pottsville Physiotherapy, and I've just got a quick presentation today on long COVID. So as you can see by this image on the screen, long COVID goes by many different names that you might have seen, but for the purpose of this, we're just going throughout this presentation refer to it as long COVID. So in Australia, at this point in time, there has been a recorded 11.4 million cases of COVID. And as you can imagine, that's probably quite a lot more than that. So a lot of people haven't actually recorded their COVID viruses. So we don't even know how many, but we do know there's been almost 20,000 deaths in Australia alone from COVID. Now, the incidence of long COVID looks to be around 10% of that number. So what is long COVID? It's the continuation or development of new symptoms 3 months after the initial COVID virus. And these symptoms can last for at least 2 months, and generally they have no other explanation. So if we have a look at the timeline here, you can see in those first couple of weeks you have your acute COVID. Sometimes those symptoms can linger and you can continue to test positive on your RAT tests. That first couple of months is not considered to be long COVID as such. Long COVID is when you're experiencing those symptoms 3 months after the infection. You're no longer testing positive on your RAT tests, and these symptoms have no other reason or underlying cause, and they persist. They usually last for a minimum of 2 months. Some people are more at risk of developing long COVID, so it seems to be more in that sort of middle-aged female demographic. And some studies suggest that if you have acute COVID severely, you're more likely to develop long COVID, but not all studies suggest that, and also pre-existing comorbidities. But it's still very early days in terms of our understanding of long COVID, so there's still a lot more research to be done. In fact, we don't know exactly why long COVID happens, but these are the 5 primary theories that are going around. And as I said, we're not exactly sure if it's one or all of these or something else altogether. So you can see from the list here, there are a lot of symptoms that come with long COVID. So one of the primary symptoms that we help with here at Pottsville and Cabarita Physiotherapy is the post-exercise malaise, or PEM, or also known as post-exercise symptom exacerbation. And this is when you do your activities and you feel okay at the time, but then 12 to 72 hours after the activities, you get this worsening of your symptoms. So it's really difficult to manage because you don't know that it's happening until well and truly after the fact. And this isn't only with physical activity, it could also be mental, emotional, or social activity. And another of the 2 common symptoms that we treat here at Pottsville Physio is fatigue and breathlessness. So in this list here, you can see the most commonly reported symptoms of long COVID, and you can see at the top there that the fatigue and the breathlessness is almost half people with long COVID are getting those symptoms. So when you come in to see us here, the first thing we'll do is get you to fill in a COVID questionnaire that looks something like this, and that gives us a really good idea of where you're at now, and it also gives us a baseline of making sure that we're making progress with your treatment. We also ask you to fill in a symptom tracker, which is really valuable. So you can write down on the left-hand side here all your symptoms. So this is just an example. And then on each day, you can rate your symptoms on that scale of 1 to 10, with 1 being minimal and 10 being really severe. And that way we can just keep a track of your symptoms, see what's bothering you, because as I said, everyone presents so differently, so we can really focus in and make a program specialized for you. So what can be done? There's lots of things that we can do. You don't just have to put up with it and wait, and we'll go over some of these now in this presentation. So it's important to remember that everyone presents differently and everyone's recovery is differently. But recovery is never a straight line. We all think we're just going to slowly improve, but generally it tends to be more like these two squiggly lines you can see on the screen here. You're making a little bit of improvement, you'll have a setback, and it'll be up, down, and all over the place, but generally heading in the right direction. So something that we really need you to understand with long COVID, and we're pulling the research for this from ME and CFS, chronic fatigue syndrome. So there's a lot of overlap in symptoms between long COVID and CFS. And what this is, it's like an energy dysfunction. And this is because we don't make as much energy as a healthy person at a cellular level. So our mitochondria, the little cells that create our energy, they're just not working properly. So the analogy I like to use is it's like having a battery that never recharges fully and it drains faster than normal. So even if you do manage to have a good night's sleep compared to someone that doesn't have long COVID, you're not recharging the way that person or you might have prior to experiencing long COVID. So we've got this energy limit, and we call it the energy envelope or the store of energy. So we need to kind of imagine our little battery, and we need to make sure that we're not doing so many activities to drain the battery without topping it up. So this is something we work on a lot with you to make sure that we're doing as much as we can without completely draining our battery. So it's good to ask yourself these questions. How much rest are you needing at the moment to recharge? Or are you just constantly draining your battery because you're trying to push through and do all your normal activities and get on with it? And is that balancing out with what you're doing during the day? Or do you need to build in more rest time? So generally the answer is yes, you need to build in more rest time. So we're doing a little bit of activity, having a rest, recharging, a little bit more activity, and then slowly building it up. Because if we push, our battery will drain and we will crash, not necessarily then and there. So remember, there's this post-exercise or activity malaise. It could be occurring 12 to 72 hours afterwards. So one of the ways we manage this is by using this 3P system. So we call it pace, plan, and prioritize. And we'll go over this so you have a deep understanding. But basically, pacing means that you're just taking breaks in between your activities. You're not doing anything too strenuous for too long. And you're breaking up your activities into smaller tasks, resting in between, so you're not pushing your body to exhaustion. And so to be able to pace, we need to plan and prioritize. So planning is just looking at your day, the next day or the week ahead, looking at what activities you've got to do, thinking about how much energy those activities are going to require, and just planning those into your day and planning rest time around. And this means that you're probably not going to be able to do everything that you want to be able to do every day. So we do need to learn to prioritize. So we like to look at the activities that we want to do for the day and then prioritize them in what has to be done, what we'd like to be done, and then things that maybe don't need to be done at all. And then we can work out rest in between that to make sure we can get as much in as possible without draining the battery and exacerbating your symptoms. So here's a little example of the person on the left. There is pacing, they're doing a little bit of activity, they're having a rest, doing a little bit more, and they're never pushing into that COVID energy threshold, so they're not burning out. And then the one on the right, of course, is just go until they crash, and then they crash really hard and they stay down there for quite some time. So it might be that you're in bed for 2 or 3 days recovering from that one day of effort. So in the end, you could have got that same amount of activity in without having that big crash over that same 3-day period, rather than doing it all in one day and then having to rest for 2 days following. So let's talk a little bit more about pacing. And the little line at the top is one I like to use, which is do your best and leave the rest. So at this point in time, you need to come to a little bit of acceptance that you are not going to be able to get everything done that you want to be able to get done. So just do your best and leave everything else behind. So first and most important, we need to recognize that we have this energy limit, this battery problem. And where I like to do that is starting a diary. As I said before, rating all your activities with low, high, or medium energy requirements. I like to get the highlighters out, make it, if you can, red, green, and orange traffic light system. So the red ones are the high energy, the green ones are the low energy. So that your diary has got all the colours, so that we're making sure we're not having one day with a lot of red or one day, we want it to be quite colourful. We want to rate our symptoms in our diary, as I said, and we want to look at each task and think about how important it is, what to prioritise, where we can put rest in. Do we need to leave longer times around those red or those high energy activities? And it's all about being organised and prepared. And if we can do our diary and be prepared and learn to outsource or say no or ask for help for some of those activities, accept that we might not get everything done in that day. We might only get half done one day, finish off the rest the next day, or it might not be perfect. Then we're going to balance out our energy use better, and then we'll slowly be able to build on that and get more and more into each day. So some people with this condition find that they have more energy at certain times of the day. So it might be in the morning, mid-morning that you're feeling the best. So if you do have a red activity or a high energy activity, it would be best to put that activity in that time. So you're doing it when you're least fatigued. And so it's a really good idea to work out what your baseline is, and we slowly want to increase that baseline up over time. And what we want to do is really avoid this boom and bust cycle. So like you saw on the diagram before, where you're going for it, doing everything, and then having that big crash. Another thing that's really important when you're this fatigued, there's a lot of things that have to be done. You might have to get the kids organised, you might have to go to work, things that are taking up, all those things are taking up all your energy, but it is really important to try to include at least one pleasurable activity in your plan every day. And this is really important to your recovery. So if we're just focusing on the jobs and the tasks, the recovery tends to be a little bit slower than if we put in these pleasurable or happy activities each day, just to help reset and regulate the nervous system. You tend to get a little bit of a faster recovery. So I just put this up here to remind you, it's not just the physical tasks. It's also the thinking tasks and the social tasks. The mental side of things can also be very draining for the battery in the long COVID client. So here's a little diagram that we might use. So we might give you something like this that you can break down your tasks. And here's an example of the diary that we might use. And you can see there that you've got every day, you've got all the times, putting in what you need to do and then highlighting it with the colour. So we want to make sure, as I said before, that there's not too much red in every day and that there's plenty of rest and sleep time there as well. So as you improve, you can slowly take on more, and this could be that you're doing the same task but with less rest in between, or you're doing that same task in a smaller block of time, or you're adding more tasks into your day or more red tasks into your day. But we want that to be very slow and incremental, so we're thinking about like a 10% add-on as making sure that those symptoms aren't exacerbating. And remember, you might have the exacerbation 3 days afterwards. So we need to take it very slowly and not be adding in any more than every 4 or 5 days. So I said that it's really important to include rest and relaxation into your day to help to recharge your battery. So what does this look like? Now this is very individual, and it's definitely different for everyone. So you might want to try some different strategies to see what works for you best. So as I said, some people find social and mental things very challenging and very draining. So they wouldn't be in your rest and relaxation. So if that's you, watching stimulating TV, being on social media, talking on the phone, probably isn't going to recharge your battery. Whereas for someone else, it could be a great option. So for those people, maybe just a meditation, lying down, doing some breath work, listening to some gentle music, sitting out in nature, looking at the beach, the ocean, looking at some trees, reading, different things like that could be very effective. So there's lots and lots of different rest and relaxation strategies, and we can go through those and help to find something or a list of things that are going to be effective for you. So this is all about recharging that battery. It's really important also to have some coping strategies. Long COVID, it's very difficult because it's all very new and unknown. There's a lot out there, but there's still a lot of research to be done. And so having these coping and acceptance strategies to help you get through, maybe that's spending time with other people, having someone that you can talk to, or doing some internal nervous system regulation things like your breath work or your meditations. And this is a beautiful technique here, like a mindfulness technique, where you're taking some slow breaths and checking in with your senses. So you can see in the diagram there, what are 5 things I can see, 4 things I can feel, 3 things I can hear, 2 things I can smell, 1 thing I can taste. And this is just a kind of mindfulness meditation. If you feel your brain, you're catastrophizing about your symptoms and you're feeling worried or anxious, this is a lovely technique that you can come back to. And we can teach you other things as well. So it is really important to reframe your thinking and regulate your emotions, and this will regulate your nervous system. When your nervous system's regulated, your body can be in a state of healing. So you're in your parasympathetic or your rest and repair, digest state, rather than your sympathetic nervous system response, which is your fight and flight. You won't get healing and improvement in that state. So if you're constantly having these negative thoughts, you'll tend to be more in that sympathetic nervous system state. And what we find with this cognitive behavioral therapy approach is that what we're thinking affects our beliefs and our attitude and our actions and our body's ability to heal. So if we can come right back to those thoughts, catch those negative thoughts when they're coming. And these could be thoughts like, I'm never going to get better, I'm never going to be able to get back to work. Those real future thinking block beliefs, and saying, I'm able to do this today, even though I'm not where I want to be, even though I'm not better yet. I know that I can get there. I'm working towards achieving that. I managed to do this today, and having more of that positive mindset about your body's ability to heal itself, then your body's going to put itself in a better state and the healing will actually happen. So that's a very quick overview, and we can talk about that in a lot more detail if necessary. So what are some things that will help with our body's ability to heal? First and foremost is sleep. We definitely need to be getting plenty of sleep, and people with long COVID often have issues with sleep. They could be difficulty falling asleep, interrupted sleep, or sleep apnea. So here's just a few things that you can do to help get a better night's sleep. So we recommend having a really good routine where you're getting up and going to bed at around about the same time. We're aiming for that 8 hours, 7 to 9 hours every night. When we wake up in the morning, we want to get that morning daylight into our eyes. So whether you're going outside or just looking out the window, that will help to regulate your melatonin cortisol cycle, which is part of our cycle of sleeping. If you are able to walk, getting out for a morning walk in the morning is amazing. And then at night, we want to make sure that we've got a comfortable environment. So the room's a good temperature, you've got the right amount of blankets, your pillows comfortable, and all those things. The room's nice and dark. You might want to have a nice hot drink or a hot shower before bed. You tend to fall asleep better if your body's in a cooling state rather than a warming state. So that's why a hot bath or a hot drink before bed helps. And you might do some relaxation before going to bed. So that might just be doing 5 minutes of breath work. It might be listening to a guided meditation. Whatever works for you. As I said, it's going to be different for everyone, and we can help you work into a good sleep routine. And definitely trying to avoid naps during the day if you're having difficulty sleeping at night. If you need to nap during the day and you're sleeping well at night, that's absolutely fine. But if you're having a lot of difficulty at night, trying to do more of like a meditation or mindfulness or resting during the day rather than sleeping will tend to be more effective. So they're the do's. Here are some of the don'ts. Screen time, we all know we need to avoid that blue light in that couple of hours before we want to go to bed. We want to avoid drinking coffee after mid-morning. Alcohol as well, we want to avoid eating late. We want to avoid any bright lights. So it's not just the devices, it's also the bright white lights in our house. So trying to put on those warmer lights like a salt lamp or a candle, and avoiding loud noises, big conversations, watching TV, stressful kind of shows. So all those things will help towards getting you a better night's sleep. And we like you to try to get a good routine. So this could be the kind of routine that you could have, and you'll obviously make something that works for you. Eating well, we know having good nutrition helps our body to repair. We recommend just having a very clean diet. So we're avoiding those processed foods and really high in our vegetables. So in that, those not necessarily eating plant-based, but definitely having a lot of plants on your plate with every meal. So a Mediterranean style diet is generally the best one if you're looking for some more guidance, and drinking plenty of filtered water. So making sure you're getting that minimum of 33 milliliters per kilogram of your body weight. And if one of your symptoms is dizziness on standing, then making sure you're adding some salts or electrolytes into your water on a regular basis. So there are some studies on supplements that are shown to help with the long COVID recovery. So I've listed some of them here. Also taking antihistamines has been shown to help, and I've listed here how that might work. In terms of this, you don't want to go trying a whole heap of things at once, because then you don't know what's worked or hasn't worked. And I would definitely recommend having a chat to your doctor and just making sure that whatever you are taking isn't going to interfere with any other medication that you might be on. So we saw back at the beginning that breathlessness was one of the very common symptoms, and this can reduce oxygenation of the body. And so when we've got reduced oxygenation, nothing's going to work properly and it's going to delay the healing. So it's really important that we get on top of our breathing pattern. And this is something that we can really help you with at Pottsville Physio. We can teach you the correct way to breathe. We'll look at your respiratory rate. We'll look at your tolerance to carbon dioxide, and we'll give you certain breathing exercises just to reset your breathing center in your brain and make sure your breathing is back on track. So here in the diagram, you can see these are some symptoms of dysfunctional breathing. So if you've got any of those, then that definitely means you need help with your breath. And very quickly, this is what we're aiming for. So we want to be breathing in and out through the nose all of the time. We want to be breathing low into our body. So we don't want the breath to be right up in around our shoulders. We want to be getting that breath right down into the base of the lungs. Sometimes the lungs can get a little bit kind of stiff after having COVID, and you tend to breathe more shallow. So we need to teach you how to re-expand those lungs and get the whole lung working. And we want to slow our breath down. So we're aiming for that 8 to 12 breaths per minute. So I've popped down some exercise examples there with different breathing, and we can go over, once we've taught you a good pattern of breathing, some exercises that you can do at home. One of my absolute favorites is the square breath. So this is where we're breathing in for a count of 4, holding for a count of 4, breathing out for a count of 4, and holding out for a count of 4. So it's a lovely exercise to do. Check in with your breathing every hour or so, and it just helps to regulate your carbon dioxide oxygen ratios in your blood. Now, exercise is a really tricky one, and it's where a lot of people go wrong. So we really do recommend that you come in and get some guidance with your exercise. Most people think that when they've been unwell, they need to push that. They feel that they've deconditioned a little bit, so they need to push their exercise and try to rebuild their strength and their stamina, their fitness, their endurance. But with long COVID, remember, we have this post-exercise malaise or post-exercise symptom exacerbation. So if you go and do too much, you'll end up having a few days, 12 to 72 hours later, of crashing, and you'll go round and round in a cycle. So you'll do what you want to do, then you'll crash, you won't be able to do anything, you'll decondition, then you'll do it again, and you'll go round and round, and you won't be moving slowly in that upward direction. So once you're able to do your activities of daily living, so you're showering, you're cooking, your things that you have to do, then we'll start thinking about bringing some exercise into your program, and we'll work with you to create an individualized program. But the very important thing is don't try to rush this step. So beginning with very small activity just within the house, progressing to walking outside, including your frequent rests, waiting for the 72 hours minimum before progressing, and just doing one new thing at a time. So we need to do this very slowly, and it needs to be very graduated. So it's like a titrated program that we'll create for you. Now, we've got Live O2 Oxygen in our clinic at Pottsville Physio, and this has proved to be really helpful for some of our clients with long COVID. And what this system does is it alternates, so you're actually exercising, so we normally sit you on the recumbent bike, and we put a mask and you're breathing in oxygen, and we alternate between a very high oxygen level of about 80% to a very low oxygen level, around 15%. So normal oxygen in the air is about 21%. And what this alternating does is it increases the amount of oxygen that's getting delivered to your body's tissues. So we know with the majority of people with long COVID, oxygenation is an issue. So this just helps to kickstart the oxygenation to the body, and it helps. We do breathing exercises while we're on there as well. So the benefits with the Live O2 for long COVID is it's increasing our mitochondrial function. So the mitochondria, remember, is what creates our energy, our battery, if you like. So we know we've got a battery problem, so it's going to help with that. That then will accelerate the healing processes within the body. So it'll reduce how long your long COVID lasts for. It improves the cognitive function if you're having brain fog, and it helps to reduce inflammation in the body. So it's been a really effective tool for many of our clients with long COVID. We also have a red light therapy panel. So that's low level red or near infrared light that stimulates cellular repair and regeneration. And it's really working on combating fatigue by boosting the mitochondrial function as well. So the oxygen therapy and the red light therapy is really working at a cellular level to increase our oxygenation via those mitochondria. So really useful tools, especially if you feel like you're just stuck in a rut and you're not moving forward with your symptoms. This is a great way to get the ball rolling and to get that healing happening. So for our workers with long COVID, we can help you with a return to work plan. So many people just are unable to leave the house, unable to get back to work. So this is an example of another client, a graded return to work plan. So once we started to get the activities of daily living, then we started to bring in a little bit of exercise, and a few months down the track, we were starting to see signs of improvement, and this client was ready to return to work. This is kind of a general graded return to work that we did. So it's really important to understand that just one day you're not just going to pick up and be back to normal. It's got to be a really graded approach. So as I kind of touched on earlier with the coping slide, your mindset with long COVID is really, really important. We need to accept the uncertainty of it. Everyone presents differently. Everyone is on a different timeline. So we can't give you an exact answer of how long it's going to take, what it's going to look like. But as long as we're generally moving in the right direction, then we know that you're going to get to where you want to be. So accepting that uncertainty, it really helps to get the nervous system in the right state, that parasympathetic state, which will help with our healing. So if you are educating yourself, which I highly recommend, just making sure that you're seeking reliable resources. So like going onto the government websites, not going onto social media, or even a lot of the groups on social media the social, like Facebook groups, because that can lead to that catastrophization and those negative thoughts. So if we think back to those thoughts, beliefs, and actions with our cognitive behavioral therapy, we know that's not going to help with our healing. So really just making sure that you're educating yourself in the right places, and don't identify yourself as I'm a person, like I'm long COVID. Like that's not you. It's just something that you're managing at the moment, and we are going to move past that. So just having faith that the body will heal itself. You've just got to give it the right tools and start moving in the right direction. So I just wanted to put this little recap up here because it is a real energy problem. And then these are just some nice little reminders of how to improve our energy. So our rest, sensible use of our energy. So remember, that's our planning, our pacing, our prioritizing. And then energy drains, so things that we really do want to avoid. And we've spoken about all of these already, but it's just a nice little recap there. I've also included here some resources. So there's a lot of resources in here that are great resources. So if you do want more information, then you can certainly go on and look up all these resources. So that's it. Thank you so much for listening to this presentation on long COVID. I hope it's been super helpful and it's given you a place to start. And then, of course, when you're ready, we would love to help you at Pottsville Physio, whether it is just helping you with your diary, your planning, prioritizing, whether it's helping you get your breath back on track, or whether you would like to try to accelerate your rehabilitation using our oxygen therapy and our red light therapy. We are here to help you, so we'd love for you to come in. You can book online at our website, www.pottsvillephysio.com.au, or give us a call on 0266764000. We look forward to seeing you.